So there you are. You're in your early 20s. You're in the best shape of your life. You couldn't be any healthier. It's midsummer and it's gorgeous outside. You and some friends decide to take the boat out and do some water skiing. You're tearing it up. You're having a blast. But then, while you're behind the boat, you lose balance and the momentum pulls you forward. You smack your head on the water going about 30 miles an hour. Luckily, you snap back into it, but your head's bleeding and you don't feel so good. Your friends take you to the hospital and you find out that you have a concussion. No big deal because usually it's an easy fix. But you're perfectly healthy, so you didn't want any health insurance. Then the bill comes. Now, according to an article written this year and published by Guardian Direct, the average cost of a hospital visit for a concussion without any insurance is around $18,000. According to another article written by Emmy Martin for CNBC in 2019, most Americans under 35 don't even have $5,000 in their savings. This is just to show one of the many possible experiences that someone could have with our current healthcare system, and also to show you that it can happen to literally anyone regardless of their health. I'm Dylan Potts. I'm a pre-med student at MTSU, and I've done countless hours of research into our current healthcare system as well as universal healthcare in general. And I'd like to take a minute to inform you about health insurance in general since I'll be mentioning both. Now, please note, you can make up your own mind on which system's better, worse, whatever. I'm just here to help educate you on the actual systems. Starting off, it's really important to understand how we ended up with our current system. According to an article written by Dr. Linda Gorman and published by the Wisconsin Policy Research Institute in 2006, after the Great Depression, hospitals began providing a prepaid service to ensure that healthcare workers were actually paid. This was Blue Cross and Blue Shield. It was a nonprofit, and coverage meant that you were completely covered, and everybody paid the exact same price. It became so popular that the government tried to copy it. In 1965, Medicare and Medicaid were born. But the problem with Medicaid, at the time, you had to be 65 to get the benefits. The average age of death for men in the United States during that time was 66 years old. Through the years, private insurance companies have evolved into pretty much what we have now. You select a plan, and then you pay for it. To put it simply, as healthcare spending increased through the years, so did government regulations. By 2002, 20% of our healthcare budget was being spent just maintaining the regulations. Also, around the same time, private insurance began to offer a service called health savings accounts. This is mostly what you see now, especially for plans offered by employers. This means that if you don't use your health insurance, you potentially save money. Of course, the results showed that when individuals had to pay these out-of-pocket fees, they tended not to go to the hospital. To tie in universal healthcare system, through the years, many other countries have adopted some form of universal healthcare. The United States has not. But with our current political climate, it looks like we're possibly heading in that direction. So what's the benefit of these different types of healthcare? Well, with our current system, we actually have a few good things going for us. According to an article written by Gus Lubin for Business Insider in 2010, the United States leads the way in survival rates of cancer patients, as well as the sheer number of preventive screening for cancer patients. We also lead the way in identifying psychological diseases and treating them. We have the most advanced medical equipment per capita, and lastly, we pay our doctors way more than other countries, which is a great thing if you want higher quality doctors. There's other aspects as well, but those are really the big ones. With universal healthcare, it's important to understand that there are three different systems. There's socialized medicine, which is where the government is the hospitals. They increase the tax, and there's no need for insurance. The second system is government mandated insurance, pretty self-explanatory. You're required to have health insurance, similar to how most states treat car insurance. The government just regulates the insurance companies. The last system is a single payer system, which means the government is your insurance and the hospitals remain private, much like Medicare, except for everybody. According to an article written by Brian Mastrani in 2020 for Healthline, switching to any of these universal healthcare systems would save the United States around $600 billion in just administrative fees. Of course, you can also see the obvious benefits that everyone will have health care covered by the government and more people will have access to hospitals and medicine who normally wouldn't because of the cost. Now again, these are only some of the larger benefits, but let's move on to some of the disadvantages as well. According to an article written by Megan Leonhardt in 2019 and published by CNBC, the average American pays about $5,000 a year for health insurance. According to another article written by multiple authors in 2014 for KFF, in 2013, non-elderly individuals without health insurance paid less than half of the cost that other people paid for their actual insurance. I guess it's probably because they didn't go to the hospital. Also, currently nearly 40 million Americans do not have health insurance, which, as you can guess, the majority of which are considered low income. With universal health care, and note this is slightly heading into theory because we don't use these systems and it might translate differently in this country. Socialized medicine is a bit separate. Because it's completely government controlled, the big issues that come up are poor treatment, lack of choice in treatments, drugs, doctors, and hospitals. Basically, the government just tells you what to do. The other two, I'll clump together. And this goes for universal healthcare as a whole, to be honest. You're going to be dealing with longer wait times due to the increase of hospital visits, since there's no cost for anybody. Your choices are still very limited, and it's very likely you'll see a decline in productivity of healthcare workers since they're probably not going to get paid as much as they used to. Once again, these problems exist in other countries, but they may or may not translate if this was implemented here. It's still hard to determine how they would translate. So, so I went over the history of our system and some good things and some bad things about our system, as well as universal healthcare. With this being one of the hottest topics in politics, and the country so divided over it, I hope I was able to give you a little bit of insight and make up your mind on which system that you like, and that you can enter your next discussion about healthcare a little more educated. Thank you for listening.